this is Dr. Kim Langdon. I'm with CCM Health, and today we're going to talk about chronic kidney disease. We'll be talking about what causes kidney failure, some of the things you can do to prevent it, how it's treated, how it's diagnosed, and some topics regarding dialysis and transplant. So with that, let's talk about chronic kidney disease. So what is it? It means your kidneys are damaged and can't filter blood the way they should. The disease is called chronic because the damage to your kidneys happens slowly over a long period of time, and this could lead to buildup of waste in your body. 37 million suffer from chronic kidney disease, and 9 in 10 adults with chronic kidney disease do not know they have it. 2 in 5 adults with severe kidney disease do not know they have it. What are the conditions that affect the kidney? Well, diabetes is the leading cause of chronic kidney disease. High blood pressure is the second leading cause of chronic kidney disease because it damages the blood vessels that supply your kidneys. 1 in 5 adults with high blood pressure has chronic kidney disease. People with heart disease are at higher risk for kidney disease, especially if they have congestive heart failure. And then a family history of kidney failure is also a risk factor for chronic kidney disease. What are the conditions that affect the kidney? Well, glomerulonephritis is a big word, but it's a group of diseases that cause inflammation and damage to the kidney's filtering units. And these disorders are the third most common type of kidney disease. Then there's inherited diseases like polycystic kidney disease, which causes large cysts to form on the kidneys, which damage it. Kidney and urinary tract abnormalities before birth can also lead to narrowing of some of the outflow of the urine, which can then push urine back into the kidneys and damage it. Autoimmune diseases such as lupus can damage the kidneys, as can infections and other obstructions. So what are the symptoms? You might have dry skin, muscle cramps, vomiting, loss of appetite, swelling, difficulty urinating. The swelling comes from, you're holding on to more fluid. So your dry skin can become very itchy. That's often a sign of advanced kidney disease. Advanced kidney disease can also lead to other more severe symptoms such as chest pain, itching or numbness, feeling tired, headaches, weight loss, shortness of breath, sleep problems, and trouble concentrating. You can also develop other problems as a result of chronic kidney disease. Anemia can develop because you have low EPO levels and which come from the kidneys. So when the kidneys don't work, they don't make enough of the EPO, which can cause your red blood cell count to drop, which causes anemia, can cause bone disease, and it can lead to malnutrition. The test to diagnose and monitor kidney disease, there's a simple urine test for measuring albumin to creatinine ratio. Albumin is a protein that the kidney excretes. The blood test measures for creatinine. As that gets too high, it means you're not filtering the waste products properly enough, so that builds up in your blood. The glomerular filtration rate can be measured. That's done by collecting a 24-hour urine and comparing it albumin levels and creatinine to your blood creatinine test. And then you can get CAT scans and other tests to look for other problems associated with kidney disease. So albumin is a protein found in the blood. A healthy kidney doesn't let albumin pass into the urine, but a damaged kidney does let it pass into the urine. So you shouldn't have protein or albumin in your urine. So if they find it, that's a sign that you could have some early kidney disease. They'll also measure ratios, your urine albumin to creatinine ratio. It compares the amount of albumin with the amount of creatinine in the urine. There's all sorts of tables that determine what state of disrepair your kidneys are in based on that ratio. The glomerular filtration rate, or the GFR, 60 or more is in the normal range. Less than 60 may mean you have kidney disease. And if it's 15 or lower, you're basically in kidney failure and will need either dialysis or transplant, or dialysis and then a transplant. So it's essential that you get your kidney disease under control. The best way to do that is to control your blood pressure. Your blood glucose level needs to be kept optimal. Take your medicines as prescribed. Work with a dietitian for a healthy meal plan. Make sure you're physically active. Get to your optimal weight. Get enough sleep. Stop smoking. And join a support group to manage the stress and sometimes depression that comes with this. The most important step you can take is to control your blood pressure. High blood pressure can damage your kidneys, as well as kidney failure can lead to high blood pressure. But you can protect your kidneys by keeping your blood pressure at the 140 or 90 or lower. Other things you can do is eat healthy, low sodium meals, quit smoking, get enough sleep, and take your medicines. If you have diabetes, then it's best that you keep your glucose levels under control. Your A1C is a blood test that measures the average blood glucose level over the past 3 months. The higher the A1C, the worse your control is. The goal is to keep it as close to 7 or lower. 7% is considered acceptable. Anything higher than that means your glucose is not as well controlled as it could be. You're going to want to work with your health care team. They're going to want to monitor your kidney function over time. They don't want your GFR to go down. They don't want your albumin levels in your urine to go up. And they'll be checking your blood pressure and blood sugar. Take your medicines as described. You'll often be put on something called an ACE inhibitor, an ARB, which may slow kidney disease and delay kidney failure. It may even help in people who don't have high blood pressure. So sometimes you'll need to take more than one medication. 2 or 3 are not uncommon when you have high blood pressure that can't be kept under control. Sometimes a diuretic will be added as well. Over time, there may be adjustments made in the dosage or the type of medication you'll be taking. Sometimes you'll take more, sometimes you'll take less, but your doctor and your pharmacist will keep tabs on all your medications. Make sure you have a list of all the medications you take and the dosages. Be careful about over-the-counter medicines you take. For instance, non-steroidal or called ibuprofen or naproxen should not be taken if you have kidney disease, or discuss with your doctor before you do. They're sold under many different brand names. So anytime you see NSAID, NSAID, that's a no-no if you have kidney disease. As we said, it's not always possible to prevent chronic kidney disease, but you can get enough sleep, at least 7 to 8 hours, stop smoking, limit your alcohol intake. It basically says you can have 1 drink a day if you're a woman and 2 drinks a day if you're a man. That equates to 1 drink is 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of liquor. Here we go with the fruits and vegetables, salads and seeds. That's what you should be eating the most of, and you'll need to meet with a dietitian or nutritionist to discuss this in more detail, depending on the level of your kidney disease. She'll work with you to develop a medical nutrition therapy, and there's all sorts of diets out there and meal plans that can help you live a very satisfying life with chronic kidney disease, provided you take all the necessary changes. Try to prepare your foods with less salt and sodium. Basically, salt is sodium. Eat the right amount and types of protein. Choose foods that are healthy for your heart. We want to stay away from food and drinks with a lot of phosphorus, and make sure you're getting enough potassium. You should make sure the physical activity, no matter what your underlying health status is, physical activity should be part of your daily routine, 30 minutes a day, 5 days a week. Just walking is plenty good if that's all you feel like doing, but the more, the better. Physical activity also helps lessen depression. It helps with your sleep habits are improved with exercise. Other things you can do to cope with stress is focus on something calm and peaceful, or do yoga or meditation. If it is severe, you need to talk to your healthcare practitioner. There are other coping strategies and medications you might be prescribed. So that's it for chronic kidney disease. I hope you learned a lot. If you'd like to visit our website or social media sites, you'll find out more about all these conditions and any other health condition that you might be interested in. Thanks and have a good day.